We have new members who are joining us. I am ecstatic that we now have the largest majority since 1956.
I think there's no question that President-elect Trump brought a whole group of new people into the process. I mean, as we went around the state knocking on doors, as you guys know, we knock on doors based off a voter list. And often as we're going down the streets talking to people, we come across houses that aren't on the voter list, but yet they had a Trump and a Johnson sign in the front yard. And talking to them, these are people that haven't voted in years, if not decades. I'm excited to see what their plans are for the first 100 days. I'm hoping that a bulk of their new ideas are giving power back to the states and allowing us the ability to control more of our own destiny.
To what extent was this also about changes in voting law, voter ID, non-competitive districts that have been gerrymandered? Is that a factor?
Wow, that sounds like somebody who lives in Madison. But it's not. The reality is, if you look all around the state, Hillary Clinton was a truly uninspiring candidate. Bernie Sanders, there's something that he tapped into months ago. You saw the amount of focus that he and his supporters put on. I also think that people in this election, it was pretty clear to me, they wanted somebody who spoke plainly and had an actual plan to get things done based on a record of accomplishment. Hillary Clinton talked an awful lot. She had detailed policy proposals, but she was just more of the same.
If the federal government hears your request that block grants Medicaid, gives you guys more authority, you can reduce coverage, keep it the same.
Well, that's a lot of ifs in that question. I would love the opportunity for them to give us the flexibility to make our own decisions.
Would you reduce coverage?
It's too early to tell. We have to look. I mean, that's not our goal. Our goal is to increase coverage and do it in a way that doesn't distort the marketplace into somehow creating winners and losers like Obamacare did.
Increase coverage in what way?
Well,
More people on Medicaid?
No, not necessarily. Remember, we had the high-risk sharing pool. So we had people who were difficult to cover in the private sector. We still help those folks out. So I think there are an awful lot of ways. Do I agree with some of the things that were part of Obamacare? Yes. I think that trying to deal with pre-existing conditions so people couldn't be denied health insurance, I think that was a good part of the bill. We'd like to make sure that we have, drug testing for folks who are on public benefits to make sure that they go into treatment.
Didn't the Senate results, though, just kill a gas tax increase for 2 years? I mean, it's dead, right?
We don't know that. Why do you say that?
Why do you say that?
Because the governor says he's vetoed it, the Senate Majority Leader says that he won't do it, and there's a huge conservative swing in the Senate. Why would it pass?
If there are people who can't get to a consensus saying they actually believe in good roads, well, I'd be happy to have that conversation and engage the public. Because if I've talked to people over the course of the campaign, one of the things that most people on both sides of the aisle said they want are good roads and the ability to make sure that we have infrastructure repaired in our state.